we heard an update from the KarMMa study, which is a phase 2 study where the efficacy of an anti-BCMA CAR T, BB2121, also called ide-cel, has been studied in patients with relapsed and refractory multiple myeloma. So the results included more than 120 patients with extensively pretreated multiple myeloma with a median of 6 lines of treatment. So the majority of these patients were really end-stage disease. And so in the beginning of the study, different dosing of CAR Ts has been studied, but it was found that a dose of 450 million cells is the optimal dose. And in terms of results, so it's very impressive. So we see that the large majority of these patients, 82% to be precise, respond to this treatment. Response are rapid. They are high quality responses. Many patients achieve complete remission. A significant percentage of patients reach MRD negativity, which is really unprecedented in these last line treatments. And in terms of duration of response, so in the 450 million dosed cohort, the median PFS is around 1 year. Of course, given the impressive responses, one would even ask for more. That means for longer response duration. But I think we all know that we are at the beginning of a new era. And so we need to learn much more about the survival, about the maintenance of the CAR Ts in the body of the patient. Of course, it's a new type of treatment, and this can also come with some side effects. So there is cytopenia, which is seen with all CAR Ts, and of course there is cytokine release syndrome. And nearly all patients will develop some degree of cytokine release syndrome, but most importantly, the CRS is mostly mild to moderate, so it's easy manageable, and very few patients will develop severe CRS. In terms of neurotoxicity, which we know is very common with anti-CD19 CAR Ts, well, with the anti-BCMA CAR T, and in particular with ide-cel, it is not common. And when it occurs, it is also mild to moderate. And then finally, we have also done a sub-analysis on quality of life, because we do know that myeloma is a very symptomatic disease, and especially in extensively pretreated patients, the quality of life is usually very poor due to disease and due to all the different preceding lines of treatment. And this has been done by doing standardized scales, the EORTC, QoL C30, and the Myeloma 20 scales. And in brief, one can say that with this CAR T treatment, there is a significant and clinically meaningful increase in several parameters of quality of life. And that's also reflected by our own experience, so that these patients, after a couple of weeks after the treatment, they have a more or less normal life again, and that's really impressive. That's really very meaningful for patients affected by multiple myeloma.